Thank you, Fadila. Good morning, good afternoon, and good evening. Last week saw the highest number of COVID-19 cases reported so far. Many countries in the Northern Hemisphere are seeing a concerning rise in cases and hospitalizations. And intensive care units are filling up to capacity in some places, particularly in Europe and North America. Over the weekend, a number of leaders critically evaluated their situation and took action to limit the spread of the virus. We understand the pandemic fatigue that people are feeling. It takes a mental and physical toll on everyone. Working from home, children being schooled remotely, not being able to celebrate milestones with friends and family, or not being there to mourn loved ones, it's tough and the fatigue is real. But we cannot give up. We must not give up. Leaders must balance the disruption to lives and livelihoods with the need to protect health workers and health systems as intensive care fills up. In March, health workers were routinely applauded for the personal sacrifice they were making to save lives. Many of those health workers who have themselves gone through immense stress and trauma are still on the front lines facing a fresh wave of new patients. We must do all we can to protect health workers, and the best way to do that is for all of us to take every precaution we can to reduce the risk of transmission for ourselves and others. No one wants more so-called lockdowns, but if we want to avoid them, we all have to play our part. The fight against this pandemic is everybody's business. We cannot have the economic recovery we want and live our lives the way we did before the pandemic. We can keep our kids in school. We can keep businesses open. We can preserve lives and livelihoods. We can do it. But we must all make trade-offs, compromise, and sacrifices. For individuals, families, and communities, that means staying at home, especially if you have been exposed to a case. Furthermore, you continue to maintain physical distance, wearing a mask, cleaning your hands regularly, coughing away from others, avoiding crowds, or meeting friends and family outside. For governments, it means doing the same things we have been calling for since day one. Know your epidemic. Break the chains of transmission. Test extensively. Isolate and care for cases. And trace and provide supported quarantine for all contacts. With these measures, you can catch up to this virus. You can get ahead of this virus, and you can stay ahead of this virus. We say this because we have seen in many places around the world get ahead and stay ahead of the virus. There aren't magic solutions to this outbreak. Just hard work from leaders at all levels of societies, health workers, contact tracers, and individuals. And then, once you have the upper hand, it's important to strengthen health systems, the health workforce, and contact tracing systems so that the virus doesn't take hold again. Science continues to tell us the truth about this virus, how to contain it, suppress it, and stop it from returning, and how to save lives among those it reaches. Many countries and cities have followed the science, suppressed the virus, and minimized deaths. From Dakar to Melbourne, Milan to Islamabad, New York to Beijing. When leaders act quickly and deliberately, the virus can be suppressed. For leaders, as my colleague Dr. Mike Ryan said back in March, the most important thing to do is move fast, have no regrets. But where there has been political division at the national level, where there has been blatant disrespect for science and health professionals, confusion has spread and cases and deaths have mounted. This is why I have said repeatedly, stop the politicization of COVID-19. A pandemic is not a political football. Wishful thinking or deliberate diversion will not prevent transmissions or save lives. What will save lives is science, solutions, and solidarity. That's why we say solidarity, solidarity, solidarity. Finally, last week WHO conducted its first global e-learning courses on health and migration, addressing a critical and often neglected topic of global health. The course included being directly connected live with health and migration projects on the ground so that they could receive direct feedback from those in the field. There were people attending from 122 different countries worldwide, and I would like to take this opportunity to congratulate all individuals, all involved in this course. All of public health suffers when any community is excluded. It's vital that all countries include refugees and migrants in their national policies as part of their commitment to universal health coverage. I hope the knowledge gained through this course will act as a catalyst for health policies that include migrants and refugee communities. Health for all means all. I thank you.
Thank you, Dr. Tedros. We will now open the floor to questions from members of the media. I remind you that you need to raise your hand, use the raise your hand function in order to get in the queue to ask your question. And please don't forget to unmute yourself. Let's start with Naomi Kresch from Bloomberg News. Naomi, can you hear me?
Yes, I can. Can you hear me?
Yeah, very well. Go ahead, please.
Great. Thank you for taking my question. And I was just wondering, given the current rate of spread of the virus in Europe, whether you think it will be possible at this point to stop this wave of the virus without another lockdown.
Thank you, Naomi.
Sorry, I'll begin and then perhaps Mike will add. I'm sure he will. Yes, I mean, I think there are many. First of all, the virus is spreading differently in different parts of the world. Even across Europe, the virus is not uniformly spreading. There are hotspots of activity in terms of virus transmission, where we are seeing increases in case numbers, mainly in many parts of the world because we have better surveillance to be able to detect. The worry that we have right now are increases in hospitalizations and increases in ICU rates. And in many cities, we're seeing beds filling up too quickly. And we're seeing many projections of saying that the ICU beds will reach capacity in the coming days and the coming weeks. But there are many things that countries can do to be able to bring this under control. Countries across Europe, remember, countries across Europe brought transmission under control in the springtime into the summertime with case numbers at very low levels, and they can do this again. I want to repeat that they can do this again, and they will do this again. How it is done is what is important right now. There are many countries that right now are looking, taking a very critical look at the situation currently in their countries. They're looking at where transmission is occurring and looking at where it is most intense to see what interventions need to be put in place in those specific locations. We are still hopeful that countries will not need to go into these so-called national lockdowns. What they will be able to do is use the tools that they have in hand with ample testing, with finding suspect cases, individuals who are sick to stay home. If you have been exposed to a case, you stay home, where we have good clinical care for individuals so that they can seek the medical care and receive the medical care that they need. We need everyone to contribute. We can avoid national lockdowns. We can avoid massive restrictive movements if everyone plays their part. This does mean, as the Director General has said, as we have said, it means individual sacrifices. And in many parts of Europe and in North America in particular, there are many things that each of us can do. The decisions that we make every day about avoiding crowded spaces, about avoiding enclosed settings for prolonged periods of time, about postponing some of those gatherings that we may want to have. And it's sacrifices that we all have to make. But these are the tough decisions that each of us can make in the fortunate situations that many of us live in to be able to contribute to reducing our exposure and reducing the chances of us getting infected. And by taking these measures, our schools can stay open. And we need to do everything that we can to keep our schools open, especially for the youngest kids across the world, because of the benefits that we have for young children. So there are ways that we can apply the measures at hand. Isolation of cases, identification and isolation of cases, and really critically, identification, support for quarantine for contacts. This can go a tremendous way to be able to bring these under control. The other option is if we don't quarantine contacts of known cases, then everyone's going to have to be in quarantine, and that's what we want to avoid.
Thank you. Dr. Ryan would like to supplement?
No, I think Maria covered it, but again, just to say that in the last week, 46% of all the global cases in the world were from what our European region is. Not that obviously extends from Vladivostok to Reykjavik, so it's a larger conceptual footprint than the European Union, and about nearly 1/3 of global death. So there's no question that the European region is an epicenter for disease right now, and as Maria said, though, that's not consistent across the whole. The DG said something very important, I think. He said we need to get ahead of this virus, and then we need to stay ahead of this virus. And sometimes in a race, you can use certain tactics at a certain time. Right now, we're well behind this virus in Europe. So getting ahead of it is going to take some serious acceleration in what we do, and maybe a much more comprehensive nature of measures that are going to be needed to catch up with and get ahead of this virus. But as we've seen in other countries, once you get ahead of the virus, you can stay ahead, but you need to follow through on those measures. You need to follow through on the public health surveillance, on the follow-up of contacts, on community engagement, on supporting people in quarantine. And I think this is going to be a double-pronged approach here. I think we will have to get ahead of the virus, and it may require further sacrifice for many, many people in terms of their personal lives. But once we do get ahead, we can't squander that opportunity. And we have to put in place stronger measures to keep ahead of the virus. Some countries have done that around the world. They've managed to stay ahead of the virus, keep their numbers low. The difficulty in Europe, and particularly in the European Union, and this is a genuine difficulty, the European Union is an economic, social integration organization that has had huge success in bringing social, economic rights, environmental rights, and many things across Europe. It is, in its construction, probably prevented a Third World War and was constructed so we could come away from a huge conflagration in the middle of the 20th century. In that sense, it is built on a principle of openness and transparency and sharing of responsibilities. And it is not so easy in that context to put barriers and walls up again when Europe has spent 50, 70 years trying to break down barriers and break down walls. So it is not an easy thing to build a coherent response across so many countries with such different approaches, with so many land borders. So I think we have to look at that very seriously in the context of the European Union and the context of the region as a whole. There's a lot of free movement, and therefore, on those principles, it may require shutting down and restricting movement and having stay-at-home orders in order to take the heat out of this phase of the pandemic. But it doesn't mean that then we should not move forward with the other measures, and I think this is going to be the trick. Can we get to the holiday periods of Christmas with a lower number of cases, and then can we sustain that lower number and then introduce vaccines at a low number of cases, thereby magnifying and amplifying the effect the vaccine will have on behalf of the people we serve.